Hello and welcome. Good day. You are listening to WHO and today's World Tuberculosis Day press conference. My name is Christian Lindmeier, and we're doing this ahead of World Tuberculosis Day, which is observed on 24 March each year to raise awareness and understanding about one of the world's top infectious killers and catalyze action to address its devastating health, social and economic impact around the world. The theme of World TB Day 2022 is Invest to End TB, Save Lives. This is much needed due to the reversal of gains in the TB response caused by the COVID-19 pandemic, as well as the ongoing conflicts in Eastern Europe, the African region, and the Middle East that puts progress at risk. WHO will release new guidelines on addressing TB in children and adolescents today that will help address the severe gaps in access to TB, prevention and care faced by its population. You have been sent a press release under embargo beforehand. The embargo is now lifted, so everything is ready to go ahead of World TB Day. A note on the procedures before we get ahead. I'll introduce the speakers in a moment, and you will see we are very aware of the special situation we are in with World TB Day this year with the war in Ukraine ongoing. So we have broken up the panel a little bit in order to give you enough information on each of our points here today. So we have two speakers actually joining here in the room today. And first and foremost is Dr. Teresa Kazaeva. She's the director of the Global TB program at the World Health Organization. She will present the status of the TB response and the calls to action for World TB Day this year, emphasizing also the impact on the pandemic and its ongoing conflict. Welcome, Teresa. We also have here Dr. Kerri Viney. She's team lead for vulnerable populations, communities, and co-morbidities at the Global TB program here at WHO. She will present the new guidelines released today on management of TB in children and adolescents. We have a very special guest who's joining us online, and that's Ms. Ciara Goslett. She's an adolescent drug-resistant TB survivor, and she's joined from South Africa. And she will share her personal experience, and we're really curious to hear what she will say. After this, we will go back and give you a bit of an oversight on what the situation for TB and the preparations WHO is doing in the Ukraine right now. So again, we'll do two parts, so to say. But first, we'll start, of course, with World TB Day 2022. Dr. Kasaeva, please.
Ladies and gentlemen, it's an honor to join you today in advance of World TB Day. Let me start with some grim news first. We reported late last year that TB deaths increased for the first time in over a decade, with COVID-19 causing major disruptions to access to TB care. The situation continues to look bleak according to the data reported monthly from 90 countries. There has been insufficient progress made in closing case detection gaps, with still far fewer people diagnosed and treated or provided with TB preventive treatment compared with 2019 before the COVID-19 pandemic. There remains a shortfall of 13% in notifications of people with TB compared with before the onset of the pandemic. The situation is even worse for children and adolescents with TB. An estimated 63% of children and young adolescents below 15 years with TB were not reached or not officially reported to have accessed life-saving TB diagnosis and treatment services in 2020. The proportion was even higher, 72% for children under 5 years. Almost two-thirds of eligible children under 5 didn't receive TB preventive treatment and therefore remain at risk of illness. Socioeconomic consequences of the COVID pandemic, compounded by the ongoing crisis and conflict in Eastern Europe, Africa, and in the Middle East, have further exacerbated the situation, especially for the most vulnerable. This is why for World TB Day this year, our call and focus is on the theme, Invest to End TB, Save Lives. This conveys the urgent need to dramatically increase investments to ramp up the fight against TB and achieve commitments to end TB made by global leaders. This is vital to ensure no one is left behind in equitably accessing TB prevention and care, in line with the WHO drive towards achieving universal health coverage. Global spending on TB diagnostic treatment and prevention services fell from $5.8 billion to $5.3 billion in 2020, which is less than half of the global target of $13 billion annually by 2022. For research and development, at least an extra $1.1 billion per year is needed. Building on lessons learned from COVID-19 research, there is a need to catalyze investments and actions to accelerate the development of new effective tools, especially new vaccines for TB. Importantly, investing in the fight against tuberculosis is a no-brainer development target, according to The Economist and the Copenhagen Consensus, given the benefits gained per dollar spent. For every $1 invested to end TB, 43 is returned as the benefits of a healthier, functioning society. Recent analysis in The Lancet further bolsters this, highlighting that ending TB by 2030 can lead to avoiding 23.8 million tuberculosis deaths and almost $13 trillion in economic losses. Investments in TB programs have demonstrated benefits not just for people with TB, especially during pandemic, but for healthy systems, for strengthening health system and pandemic preparedness. On World TB Day, WHO is calling for action on several fronts to ramp up investments and ensure that commitments made to end TB are achieved. First, we would like to call for an increase in domestic and international investments to close funding gaps for TB implementation and research. However, for countries with weaker economies, especially following the enormous socio-economic impacts of COVID-19, international support will be required in the short or medium term. We need international donors to significantly increase investments and also leverage other existing and new financing mechanisms to chart the way forward to a comprehensive recovery of progress. Second, we should not forget that progress in public health depends on innovation. Financing for TB research must more than double to drive discovery of new tools, including vaccines, and to scale up life-saving innovations. WHO is intensifying efforts to shape the TB vaccines agenda in collaboration with other partners, with a high-level push this year through a global summit. Third, we need to invest in sustaining essential TB services during the COVID-19 pandemic and ongoing conflicts to ensure that gains made in the fight against TB are not reversed. People-centered delivery of TB prevention, diagnosis, treatment, and care services, including through digital technologies, should be ensured in tandem with the COVID-19 response and other emergency responses. TB needs to be included into pandemic preparedness plans for countries. Fourth, we need to invest in accelerating the uptake of new WHO guidelines and tools, including all oral treatments, rapid molecular tests that can significantly improve access, quality of care, and outcomes for those affected. Today, we are releasing new guidelines that will be presented by my colleague, Dr. Kerri Viney, on management TB in children and adolescents. Children and adolescents with TB are lagging behind adults in access to TB prevention and care. The WHO guidelines issued today are a game changer for children and adolescents with TB. We should rapidly expand implementation of the guidance across countries to save young lives and avert suffering, like that faced by young champion Ciara, who has joined us today to share her story. Fifth, we are concerned by the growing rates of poverty, inequity, undernutrition, comorbidities, discrimination and stigma, and conflicts that are major drivers of the TB epidemic. We need to invest in expanding social protection and universal health coverage, combating stigma and discrimination, as well as strengthening multi-sectoral engagement and accountability. We need concerted action and greater accountability by all sectors to provide the right services, support and enabling safe environment in the right place at the right time for people with TB. All these investments and actions can help to drive the TB response to save lives and reach the global TB targets. This will be critical, especially as we prepare to the second UN high-level meeting on TB in 2023 that will bring together heads of states and other leaders to re-energize commitments to end TB. We cannot falter in our commitment till we reach and save every man, woman, child, family, and community impacted by this deadly disease. No more excuses and delays in prioritizing and investing to end one of the top infectious killers. Invest to end suffering and deaths. Invest to end TB and save lives. Thank you.
Thank you very much. Move to Dr. Kerri Viney, and as we said before, Kerri will present the new guidelines released today on management of TB in children and adolescents. And Dr. Viney is the team lead for vulnerable populations, communities, and comorbidities at the Global TB Program here at WHO. Dr. Viney, please.
Good morning, good afternoon, and good evening. Thank you for the introduction, and it's a real pleasure to be speaking to you today. So Dr. Kasaeva has just highlighted that children and adolescents are vulnerable to developing TB, which is a preventable and curable disease. In fact, WHO estimates that 1.1 million children and young adolescents become ill with TB every year, almost half of them aged below 5 years of age. Unfortunately, less than half of these children and adolescents are diagnosed or reported, which means that there is a large detection gap. In addition, in 2020, approximately 226,000 children died due to TB, and again, most of these children did not access TB care. As well as a gap in detection, there's also a gap for prevention. Children who are in close contact with a person with infectious TB can benefit from TB preventive treatment, which reduces their risk of developing TB disease. However, for children aged under 5 years, almost 2/3 of those who were eligible for this preventive treatment didn't receive it. This is a situation that we must act to change. So to close these gaps and to further improve the management of TB in children and adolescents, in 2021, the Global TB Program at WHO reviewed its recommendations on the management of TB in this vulnerable group. We assessed the latest scientific evidence from several studies. The result of this process is updated and consolidated recommendations on the management of TB in children and adolescents along the full pathway of care, so that is for screening, prevention, diagnosis, treatment, and the provision of care. The WHO guidelines are being launched today on the occasion of World TB Day, alongside an operational handbook which is designed to provide practical guidance on how to implement the recommendations. When the new recommendations are fully implemented, we expect that this will lead to better outcomes for children and adolescents with TB, including saved lives. So these new recommendations being published by WHO today include, firstly, the use of rapid molecular diagnostic tests called Expert Ultra to detect TB using non-invasive specimens such as stool, as well as other specimens, and the inclusion of these tests in algorithms which allow healthcare workers at all levels of the health system to make a more informed decision to treat a child for TB. Then we're issuing a new recommendation on a shorter regimen to treat children with mild or non-severe forms of TB, shortening this treatment from 6 months, which is the current standard treatment regimen for this type of TB, to 4 months, so reducing the treatment duration by a third. This will allow children and adolescents with less severe forms of TB to resume schooling and their normal lives earlier, and shorter treatment will also save costs for affected families and the healthcare system. Then, 2 of the newest TB medicines to treat drug-resistant TB, called Badaqualin and Delemonid, are now recommended for use in children of all ages, including for newborn babies. This means that everyone with drug-resistant TB, including all children, can benefit from regimens that consist of oral medicines only. There is no longer a need for painful injections that can have serious side effects, including deafness, and soon we'll hear from Ciara about her story with MDR-TB. We're also issuing a new recommendation on a 6-month regimen to treat TB meningitis as an alternative to the currently recommended 12-month regimen. This 6-month regimen, based on medicines and doses of medicines that better penetrate the site of disease, which is the meninges or the lining around the brain, was shown to reduce deaths among children with TB meningitis. This is a very pleasing development, as previous studies have shown that 1 in 5 children with TB meningitis will sadly die from this severe form of TB. Finally, we have a new recommendation on the provision of decentralised and integrated TB care, in addition to more centralised or specialised services. This will allow more children and adolescents to access TB care or preventive treatment closer to where they and their families live, reducing delays and costs when accessing TB services. Then, avoiding the negative consequences of TB, including the consequences that may impact from one generation to the next. The new WHO guidelines do represent a significant step forward for children and adolescents with TB or at risk of TB. In close collaboration with technical partners, donors, WHO will now assist countries to rapidly adopt and implement the new recommendations to ensure that children, adolescents and families can benefit from high-quality TB services. This is part of WHO's aim and mandate to end TB in children and adolescents by the year 2030, in line with the United Nations Sustainable Development Goals and the milestones of the End TB strategy. This is important because children and adolescents are our future. We have the policy recommendations, we have the implementation guidance, we have child-friendly formulations of TB medicines, we have donors ready to support resources for uptake and rollout. So on this World TB Day, let us not wait any longer. Let us invest to end TB in children and adolescents. Thank you.
Thank you very much, Dr. Viney. And now we move to our special guest. Pleasure to introduce Miss Ciara Goslett. She's, I understand, just short of her 18th birthday, so we don't congratulate yet. But she's, more importantly, a drug-resistant TB survivor joining us from South Africa. And she will give us an update on her painful experience with drug-resistant TB as a child. And we will see how the new WHO guidelines being released today will be a game changer for the over 1 million kids and adolescents struggling with TB and drug-resistant TB each year. Ciara, if you're there and if you can hear us, welcome and please go ahead.
Good day, everybody. I bring you greetings from Cape Town, South Africa. Our country has one of the highest burdens of TB in the world. It is an honor and a privilege for me to be sharing my story with you today. My name is Ciara Goslett. I was born in Cape Town on the 17th of April in 2004, and I'm currently 17 years old. 6 years ago, when I was only 11 years old, I was diagnosed with MDR-TB. This was the start of a long journey to recovery. At this time, when I was diagnosed, my twin brothers were just completing the treatment. We suspect that we contracted the virus from adult family members. My two uncles who were living in the family home had passed away from non-adherence to the TB medication. My first recollection that something was drastically wrong was when my mom came to my school one day to fetch me. One look at my mom with absolute fear in my heart. She was upset, her eyes were red, and she had been crying. I had TB. I had no idea what TB was, but I said that it was something very bad. After the initial symptoms and tests, it took 2 weeks before I got my TB positive results. I still have flashbacks today from taking the TB tablets. Taking all 17 tablets every day was very hard. The worst tablet of all in my experience was the moxifloxacin. It was a peachy color on the outside and a horrible green color on the inside, and it tasted very bad. I also remember while I was at Brooklyn Chase Hospital that I was a participant on a TB trial for a black capsule. I don't know what it was called, but it affected my complexion and darkened my skin tone a lot. It also caused itchy skin. This tablet also caused severe redness if I went into the sun. The children at school called me a tomato, and I felt very bad and embarrassed. Some tablets were so big and so difficult to swallow. Taking tablets down could last up to 6 hours of struggling to swallow all. As a result, I sometimes used to have to stay up until 2 a.m. at night just to finish taking my medication one tablet at a time. This drained all my energy and I felt so demotivated. The injection was a very painful and scary experience too. I still remember the sensation of a TB injection entering into my body. I also heard that some children develop hearing difficulties. This was a fearful reality which scared me and my family. Taking the medication as a child was such a bad experience that I inevitably succumbed to the temptation of hiding my medication and found some colorful ways, creative ways of hiding tablets. My late paternal grandmother was my primary caregiver, was working full-time. She was forced to have me admitted to Brooklyn Chase Hospital in Cape Town. Arriving at the hospital was a very scary experience. I was initially placed alone in an isolation ward. I cried a lot. Tight controls in place though, and I remember the medication taking ritual with our nurse. When all of us gathered around the table in the mornings taking our medication together. No tricks were tolerated. It was more fun going through the ordeal with other children. The lesson I learned and would like to encourage everyone is that TB is curable, and we must be champions for the proper diagnosis of treatment of TB. A huge challenge for me was dealing with stigma. It was especially hurtful and lonely when family members refused to let my cousins play with me or even come near me. Today I am grateful to be fully healed and that the TB experience is behind me. But millions of children need our help. This is why I decided to be a champion for change. As I listen and learn about the new guidelines released today, I'm amazed at the successful research which has enabled the shortening of TB treatment from 6 to 4 months for mild TB disease and for the ongoing research to shorten treatment for more severe forms of TB. I'm impressed with the successes in reducing the number of tablets needed on a daily basis and the improvements in child-friendly formulations. I'm so happy that children don't need to take painful injections anymore to get better. It is also encouraging to learn that rapid molecular tests can return TB results, including detection of drug resistance in a few hours instead of a few weeks. I would like to call on world leaders to take action now and invest in implementing the new TB guidelines in countries as fast as possible. Over 1 million children in the world get sick with TB every year. I don't want them to go through the painful experience that I went through. So it is time for change. Please invest to end TB. Save lives today. Thank you for listening.
Much, Cara, and indeed, it needs the action, and it needs the action now. And as we said, invest to end TB, save lives. Now, a slight topic change, but we are staying, of course, in the TB realm. As we heard about the guidelines and the new guidelines and the new approaches, and of course the experience of children, adolescents, and grown-ups around the world. But we're also very aware of the context, and we're doing this briefing today ahead of World TB Day. So we're joined by Dr. Askar Yedilbayev, who's the regional TB advisor at the regional office in Europe, as well as Dr. Stella Bivol. She's the strategic advisor to the divisional director on infectious diseases in the country health programs division, also in the European office. And we will go over some points regarding TB right now in the Ukraine and the precautions and the measurements that WHO is taking. So I'm glad to give you those colleagues for a bit of an overview, but we start with Dr. Kasaeva with a few words.
Dear all, we are deeply concerned for the health of people of Ukraine in the escalating crisis. As you are aware from regular media briefings from WHO Director General Dr. Tedros Adhanom Ghebreyesus and WHO Regional Director for Europe Dr. Hans Kluge, that WHO across all three levels is working closely with Ukraine and neighboring countries and partners to rapidly respond to the health emergencies triggered by the conflict and to do our best to minimize disruptions to the delivery of critical healthcare services to protect people and save lives. Given that Ukraine has a high burden of drug-resistant TB, WHO, working closely with other UN agencies and partners, is trying to provide and focus especially on the needs of this category of people to enable access to TB care services for the people estimated to have TB, including for refugees and displaced populations at risk. WHO, according to its mandate, is providing technical guidance and support, working closely with the national TB program in Ukraine and other countries and partners. And I can give you example of the timely released interagency field guide on TB prevention and care among refugees and other population in humanitarian settings with the UNHCR and CDC. And we hope that it's also timely and helpful. WHO has published an appeal outlining the health needs and related costs arising from the crisis included for the diseases such as tuberculosis. The emergency appeal powered by the WHO Foundation raises funds for WHO's frontline response to deliver life-saving medicines and supplies, and to support the healthcare workforce to help people affected by this crisis across Ukraine and in neighboring countries. I would like now to turn to my colleagues from the WHO Regional Office for Europe, and they will provide further overview of key actions undertaken to enable access to TB prevention and care services in Ukraine and neighboring countries.
Yes, indeed. I mean, let's move ahead and let's move to Dr. Askar Yedilbayev, the regional TB advisor in our regional office in Copenhagen. Over to you, Dr. Askar.
Thank you. Dear colleagues, as you know, Ukraine is one of the 18 high priority countries in the WHO European region and is the country that is in the global list with high burden of multi-drug resistant tuberculosis. Before the war, Ukraine was one of the pioneering countries in response to TB and drug-resistant TB in the WHO European region, presenting a rapid uptake of the WHO policy guidance on tuberculosis and MDR-TB prevention, diagnosis, treatment, and care. Engagement of communities and civil society at the level of tuberculosis response is exemplary, and tireless work done by the Ministry of Health and the National Tuberculosis Program of Ukraine at removing barriers in accessing care. With Russia invading Ukraine, Ukraine's public health services will be derailed. Destroyed health infrastructure, including limited access to tuberculosis and public health services, is affecting the provision of essential tuberculosis services, causing significant delays in diagnosis of TB, affecting initiation of tuberculosis preventive treatment and treatment of active tuberculosis and MDR-TB. Undiagnosed and untreated tuberculosis, especially MDR-TB, can lead to a very serious public health consequences, such as much lower chances to be cured of tuberculosis and increased death. In light of the rapidly evolving humanitarian crisis in Ukraine and outside, WHO is working with authorities, UN agencies, partners, and displaced communities to ensure that essential health services are maintained and to provide desperately needed humanitarian assistance inside Ukraine and for refugees who were forced to flee to neighboring countries. The new environment and rapidly evolving operational context, when risk to lives of people affected by TB and healthcare workers is extremely high, makes provision of essential health services for communicable diseases, including tuberculosis, extremely difficult. Prior to the war, all TB medications have been distributed to the regional warehouses in Ukraine, in the regions, and patients have been provided with 1 or 2 months supply for self-treatment at home. However, there is a continued risk of stock out of medicines in Ukraine in case of any of the regional warehouses will be perished during military events. Thus, there will be a need to ensure emergency redistribution of procurement of medicines to ensure continuity of treatment. Through collaboration with the Global Fund, the Stop TB Partnership Global Drug Facility, it became possible to identify the list of immediate needs for procurement of medicines, most of which are for treatment of multi-drug resistant TB, with support of an emergency funding allocated by the Global Fund, and supply channels are being explored by UNICEF to facilitate process of these medicines inside Ukraine. So the war in Ukraine amplifies the need to talk about refugees, enabling them to have full, indiscriminate access to health and humanitarian services. This is critical now more than ever. As of today, 21st of March, over 3.5 million refugees estimated to have fled to neighboring countries since the 24th of February. And the number is daily rising. Poland has received nearly 2 million refugees, more than 60% of the total refugee population. Refugees can be vulnerable to infectious diseases because of lack of health care or interrupted care in the country of origin, because of exposure to infections and lack of care in transit, and if living conditions are poor in the destination country. WHO is supporting neighboring countries to provide health care for Ukrainian refugees, most of whom are increasingly vulnerable women and children. Every second, one Ukrainian child becomes a refugee, according to UNICEF. 50% of the 3+ million Ukrainian refugees are children under 15 years of age, according to our data. It is important to note that refugees are not the source of health risk to local populations. They're fleeing the horrors of war. Countries receiving refugees should focus on ensuring adequate health services, including prevention and treatment, that is available to their own populations and provided also to refugees in an equitable manner. For those people who flee Ukraine to neighboring countries, access to the same treatment is the largest challenge, as many of them in Europe have limited availability due to the fact that most of the countries in Europe are of low burden to TB, and they have not been prepared to treat larger number of patients. WHO is working with partners and health authorities of the neighboring countries to ensure access to tuberculosis and drug-resistant tuberculosis treatment for those refugees who require continuation of treatment and for those new cases that will be diagnosed outside of Ukraine. And all of our efforts are being done in close collaboration and coordination with the Ministry of Health of Ukraine and the National Tuberculosis Program. There are many issues to address in ensuring access to quality care, including continuity, and it is one of the top priorities for the WHO at all three levels, at the headquarters, at the regional office, and at the country office, and not only for TB, but for other communicable and non-communicable diseases. Thank you.
Thank you so much, Dr. Yedilbayev. Now we're open for your questions. Apologies for a very long introduction, but we thought we couldn't do one topic without the other, so hence we're going, we did it the way we did. We start with a round of questions, and again, if you want to get into the queue, please use the raise your hand icon on your screen. First one is Christiane Elrich from Deutsche Presseagentur DPA. Christiane, please unmute yourself.
Vielen Dank, Christian. Hello, my question is directed to Dr. Viney. If I heard correctly, you said that the solutions are there, the tools are there, the donors are there, everything's in place. So what's the problem? Thank you.
Yeah, very good question. Dr. Viney, please.
Yeah, thank you for this question. It is true we have many of the tools at our disposal. One thing I didn't speak about was the fact that we do have child-friendly formulations of TB medicines, which are available for all medicines now, or soon to be available. We do have, as I mentioned, large gaps in diagnosis. So once children are actually diagnosed, they can get onto treatment. That's not the gap. The gap is really getting children to be diagnosed with TB and finding the children with TB. Now, there are probably many reasons for this diagnostic gap in particular. Children have a slightly different form of TB to adults. There aren't as many bacilli in the sputum. This makes it slightly more difficult with the diagnostic tests that we have to actually detect TB. Traditionally, we have relied on sputum tests. It is very difficult for very young children in particular to cough up sputum and to be able to provide that for a sputum test. But fortunately now we have an expanded range of specimens that can be used to diagnose TB in children, including stool. So that can be used as well as other specimens such as gastric aspirate and nasopharyngeal aspirate. So now we have an expanded range of specimens. Children, the symptoms of TB in young children in particular are very similar to other childhood illnesses, so weight loss or failure to thrive or fever. So sometimes children might present to a healthcare service but they're not correctly diagnosed with TB. They might be diagnosed with another illness. And of course, children might present to general health services, and maybe these health services, there's not the capacity there to diagnose TB. So I think there are many reasons, but the gap is mainly the diagnostic gap and actually finding children with TB. Once we put them on treatment, they actually do very well and have just as good outcomes as adults who are receiving TB treatment. So we really need to be sort of finding these children with TB, diagnosing them, confirming that they do have tuberculosis and not something else, and then enrolling them into treatment, which is quite effective and curable. Thank you.
Thank you very much. And I realize I mispronounced Dr. Viney's name. It's Viney, not Viney, as I've been pronouncing it. Apologies for that. Next question goes to Belisa Godinho from the W Magazine in Portugal. Belisa, please unmute yourself.
Hello, thank you. Not only the pandemic, but also the conflicts in Europe make children more vulnerable in terms of health. I ask, what is the situation of children in Ukraine? How is basic health care provided? And what about refugees? How is health care provided in the countries that host them? Thank you.
Thank you very much, Belisa. I think lots of this was covered by Dr. Askar Yedilbayev already, but maybe we go over the main points again. Dr. Yedilbayev, maybe you can answer that in a summary.
Thank you very much for your question, Belisa. And again, I would like to repeat that most of the people who are forced to escape from Ukraine because of the war are women and children. And so they are, of course, vulnerable, and access to the healthcare outside of Ukraine in the neighboring countries is one of the priorities for the WHO's work. And in the neighboring countries, there is no issues of them accessing healthcare. However, inside of Ukraine, inside of the conflict zone, of course, there are many challenges of that has been highlighted, and access to healthcare services is not always being ensured because people are on the move, and there are more than 6 million people internally displaced already, in more than 18 million people affected by the war zone. So if talking about access to the tuberculosis treatment among children, it is being done by its best by the National Tuberculosis Program of Ukraine, the regional tuberculosis services, together with partners, to ensure that the treatment is being continued. And WHO is closely monitoring the situation, and together with other partners, and trying to address any interruptions in care. Thank you.
Thank you very much, Dr. Yedilbayev. Maybe we want to put that in context with conflicts and wars around the world, because this is, of course, a situation not only children and adolescents are facing now in Ukraine, but it's something which happens all around the world, unfortunately, in similar circumstances. Dr. Kasaeva or Dr. Viney?
Definitely, just briefly, children and adolescents are among the most vulnerable, and we can see, according to our latest data, it clearly shows that for example, children under 5 years who should be provided by TB preventive treatment are provided, only 30% of them received access to this TB preventive. So important, especially in the periods of conflicts when children are even becoming more vulnerable. According to access to the treatment for the most difficult category of children with drug-resistant TB, we can also globally see, unfortunately, the progress is slow. Only 11% of those eligible are provided by this treatment. So what does it mean? And I agree with the very reasonable question the first colleague raised. What are then the problems if all the tools are available and funding is available? But funding still, it's a big issue and problem, because according to our data, less than 50% of the funding needed is provided. And it includes also international funding and funding from the domestic resources. Unfortunately, TB care in many countries, even in high-burden countries, is not prioritized for the budgeting. And also we have international donors like Global Fund, and USAID is actively providing support, but others are not so much interested. And TB is infectious disease killer #2 after COVID, but the response, attention is funding, and funding is far beyond that, and seems there is a lack of understanding of the problem globally.
Thank you very much, Dr. Kasaeva. Well, one question for Ciara Goslett, if you want. Ciara, if you could change or get politicians to change one thing in the fight against TB, what would that be?
I don't actually really maybe to improve the treatment and shorten it, to just make it easier for like young children because having to take like a large amount of tablets like every single day, it's very hard. Like especially like if you're under 5 and like babies even. So yes, thank you.
Thank you so much. And a bit unfair for me to put you on the spot here, but I think it was a really good point. Dr. Viney, you want to add?
Yeah, I think one thing that we're sort of working quite actively towards is having shorter regimens and all oral regimens. And perhaps this is something that would help people like Ciara, avoiding the need for injections, which are painful, and use medicines that can have quite serious side effects, including deafness, which obviously affects someone's whole life course. It just doesn't affect them for the time they've got TB. It can affect them for the rest of their life. So I think the things that we've really been working towards for drug-resistant TB treatment, as well as treatment for other types of TB, is shortened regimens, injection-free regimens or all oral regimens, and regimens that contain the minimum number of medicines that are required to actually cure that type of TB. Ciara also spoke about the very large number of tablets she had to take. So this is something that we're actively working towards for drug-resistant TB, but as well as for drug-susceptible TB. Thanks.
So much for this, Ciara, and also Dr. Viney for the follow-up. Now we have another question from Devex, and that's Jenny Rivelo. Jenny, please unmute yourself.
Hi, yes, thank you for taking my question. Dr. Kasaeva spoke about investments earlier, $5.8 billion down to $5.3 billion. Just to clarify, that's 2020. Do you have figures for 2021? And also, Dr. Viney spoke earlier about children, almost 2/3 of children under 5 that were eligible to receive preventive treatment did not receive it. So just want to know what the total number is and why. And lastly, apologies, on the new guidelines on using stool samples, can you just clarify what's new here? Because there were some reports back in 2020, the WHO is already sort of allowing the use of stool specimens for TB diagnosis. Thank you so much.
Thank you very much, Jenny, and Dr. Kasaeva, please.
Yes, you are right. These are numbers from our last year report, and this was funding provided in 2020. We are right now collecting the new evidence, new data, which will be ready soon. But maybe I could give you some more details important. Out of these 5.3 billion available, only 1.9 billion were from the domestic resources from the low-income countries. About 1 billion were from international donor funding, and the rest, approximately 2.3 billion, were from the countries like BRICS, from the domestic resources. And now probably the gap is becoming more clear when we are giving this disaggregation of the numbers. So that's why the request is relevant both for the international donors and funders, significantly increase also for the domestic funding. So that's why we agreed with the TB community that investment should be prioritized for this year.
Thank you very much. Anybody to add from the panel?
Yeah, sure. I can add about the preventive treatment target. So we have a target set at the UN high-level meeting to reach 4 million household contacts under the age of 5 between the period 2018 to 2022. We've only reached 1.2 million, so that's the third that we have spoken about. There could be many reasons for this. A lack of sort of screening and contact investigation among this age group, because these young children are identified during contact investigation. So that might be one reason. We've also seen a COVID impact on prevention as well as treatment, of course, which has further exacerbated the situation. So they're the figures, the 4 million target for 5 years, but we've only reached 1.2 million, and probably multifactorial reasons that we haven't been able to, provide all of the children with preventive treatment who really need it. Thank you.
Thank you very much, both. And it looks like we have time for one more question because we're coming to the hour. And there's one, we can't get it on air, but it's Aishwarya from Health Policy Watch, who's asking whether there are any updates on the development of new TB vaccines. And I believe there are none, so none vaccines. So what is the news? What can we say about this? Dr. Kasaeva, please.
Yes. Definitely, new effective TB vaccines could be game changers for TB. We have just only BCG, which is 100 years old, which is not so effective. It can protect only children at the early ages. But now we learning from the COVID-19 experience, and we have 9 vaccines quite advanced in our pipeline. We are working actively with the new actors and the new platforms like mRNA platforms, and we can see that there is growing interest for the development of TB vaccines. So that's why we should build on this momentum, and we should invest enough, engage key stakeholders, and we think that it's quite possible, if it will be prioritized, before 2025 to have new effective TB vaccines. So that's why we in WHO also prioritized this area of work. We are planning to organize high-level forums this year under the leadership of our Director General and other senior WHO leadership. And we would like to galvanize efforts to attract more attention, and your support will be very much needed to attract attention to this important development. Thank you.
Thank you very much. And Cara Goslett wanted to add on the point of research and vaccines. Cara, go ahead.
No, I wanted to ask if we could just for new drugs and vaccines, just like improve. That's all. Improve on research.
Yeah, thank you very much. And that's actually a really good closing sentence already. So with this, thank you very much, Cara, for joining us today at this pre-World Health Day 2022 press briefing. And I want to thank my panelists here, Dr. Teresa Kazaeva, Director of the Global TB Program, Dr. Kerri Viney, Team Lead for Vulnerable Populations, Communities and Co-morbidities. Again, and of course, Ciara Goslett joining us from South Africa as a drug-resistant TB survivor. And thanks also go to our regional TB advisor in the WHO Regional Office for Europe in Copenhagen, Dr. Askar Yedilbayev. Thank you all very much, and thank you out there for listening. Have a good day.